This is the Registered Behavior Technician course presented by Shaza Attar. The course content was created by Shaza Attar and is the property of Autism Therapy and Training, Inc. All rights are reserved. This training program is based on the Behavior Analyst Certification Board 2018 RBT Task List 2nd edition and is designed to meet the 40-hour training requirement for the RBT credential. The program is offered independent of the BACB. Remember, in each class, we will have our active listening, a quiz, and a competency assessment. Have you ever been in a situation where you're standing in line waiting to order your coffee and a guy asks you for the time, but you can't help and notice that the big clock that's on the wall? Or you're at work and a coworker is talking about a personal topic so loud that everyone in the office can hear? Or maybe your spouse walks into the room, takes a deep breath, and flops on the couch. We all have observed these kinds of behaviors, and sometimes you wonder, why? Why is he asking me for the time? What does he want? Or why is she talking so loud in the office? Or what's wrong with my spouse? Often we're trying to decipher these behaviors and understand why they're occurring. So before we understand the underlying cause of behaviors, we need to figure out how do people engage in these behaviors to begin with. Is it biological or learned? Over many years of research and understanding behaviors, most problem behaviors are learned. This means that there is an interaction between the environment and behavior which has maintained this problematic behavior. For example, a boy asks his dad for a cookie and his dad says, "No cookie, not now, after dinner." And the boy begins to cry. His dad feels bad and gives him the cookie. The relationship here is the child cries and the cookie is given. This is often accidentally reinforced and is not intentional. However, the child quickly learns that when they engage in a specific behavior, something will happen as a result. In many of my classes, I talk about children and problem behaviors, but behaviors are not specific to children. There are many behaviors that adults engage in that are learned, such as gambling, drugs, excessive eating, shopping, and so on. Behaviors are things we say or do. They usually act as a means to getting things around us. For example, when someone says something like, "Oh, is it hot in here or something?" Is that really a question, or is that person trying to get something? Maybe they want someone to open a window or turn on the AC. When we talk about behaviors, many will refer to problem behaviors as simply behaviors. But the reality is, behaviors can be ones we want to target and increase, or ones we want to target and decrease. So be sure to refer to problem behaviors as problem behaviors and not just behaviors. Today I want to outline different types of problem behaviors, the topographies, discuss functions of behaviors, and different types of functional assessments that are used in the field. In a later class, I'll discuss some strategies that can help reduce these behaviors. Firstly, no one likes to see problem behaviors. The tantrum-like, flopping to the floor, kicking, screaming, banging their head, hand-biting, or any of these behaviors that shows that the client is in distress. Parents absolutely do not like seeing their kids in distress, and that's understandable. You want your kids to be happy, so if you're a parent taking this course, it's important to acknowledge that if you feel reluctant to use these strategies that are given to you or by your behavioral team because you want the crying to stop and your child to be happy, we understand. But from a behavioral perspective, handling a behavior head-on may be challenging in the moment or the few times you deal with it, but the overall outcome is more positive than if you're beating around the bush. If you're a therapist or teacher and you're working with individuals with autism or developmental disabilities for the first time and you witness problem behaviors, it can be very scary, emotional, and overwhelming. I'll tell you a story. When I started in the field, my first experience was with a little boy diagnosed with autism in a daycare. I shared this story in one of my first classes, so I won't repeat the whole thing. I was working with, let's call him Johnny. He's the one that made me want to continue in the field. So I got a job at a center for children with autism. I was so excited, and my first week on the job, I was ready to quit. The children were older, seemed more severe, the behaviors were constant, and it was so emotionally draining. I didn't think I could continue. It broke my heart to see the children in that way. I remember going home one day telling my family, this isn't for me, and I'm going to quit. I couldn't engage the children. They were crying and screaming all the time. And basically, I felt that it was just too hard. All they said was, just give it a month. So I did. And it was the greatest month of my life. It shaped me into who I am today and allowed me to share the feelings that many new therapists have when they start working in the field. It's overwhelming, it's draining, it's hard. It takes patience, creativity, and most importantly, it takes passion. What made me love my job so much was seeing the children progress right in front of me. The moral of the story is, if you have passion for children and teaching and love a challenge, this field could be for you. But you need to be patient. Give yourself time to learn and grow, because this doesn't just happen overnight. The topography of behavior is essential when describing it in observable and measurable terms. Johnny engages in aggression in the form of hitting others, kicking, and so on. Topography is what the behavior looks like. Aggression is violent behavior towards others, such as kicking, pulling hair, pinching, and can also be in the form of verbal aggression, such as cursing. Self-injurious behaviors is violent behavior towards oneself, such as banging head, biting self, eye poking, and so on. Self-stimulatory behaviors, these are repetitive movements of the hands, body, or of objects. Some observable behavior seen in children with autism is hand flapping, rocking, or spinning wheels on a car. Non-compliance is the refusal to follow instructions. Property destruction is damaging the environment or items by ripping teaching material, clearing the table, throwing chairs, and so on. Problem or disruptive type behaviors involve flopping to the floor, screaming, crying. All right, so this is a lot to take in. I'd like to do a Marvel character. The character is Thor, spelled T-H-O-R, Thor. All right, so let's move on. When a behavior occurs, children can use a variety of these forms, but may have the same function. So let's get into the reason why or the function of the behavior. This is what functional behavior assessments are looking at. Social positive reinforcement, which is also known as attention-seeking behaviors. Tangible reinforcement, also known as gaining access to a reinforcer. Social negative reinforcement, these are escape-motivated behaviors. Automatic positive reinforcement, which is known to many as stereotypic behaviors. We will also outline automatic negative reinforcement. I'm going to break down each one for you and discuss the function and when these behaviors may appear. Attention-seeking behaviors are defined as gaining attention from an adult or peer that serves as a reinforcer, therefore maintaining the behavior. Attention-seeking behaviors are not just you talking or looking at the learner. This can be head turns, soothing the client, or even facial expressions from others. This is probably one of the hardest types of interactions to control because often the person interacting with the learner is unaware of their own behavior. For example, a child may scream and the therapist may quickly look at the child in an attempt to understand why they're screaming. Or a child grabs your face and turns it towards them to ask you a question. These behaviors may exist because the individual is unable to request attention appropriately from others, or because others are typically occupied and minimal attention is given to the individual at that time. Here is an example of the breakdown of the behavior and environment. The parent is on the phone. The child screams. The parent asks the child why they're screaming while covering the phone. Sound familiar? This happens quite a bit. Behaviors that are maintained by gaining access to a reinforcer is when a learner engages in problem behavior to get the desirable item. For example, a child grabs a toy off the desk and is now playing with it happily. Therefore, grabbing is reinforced. This is a common problem in practice when a therapist places a toy on the table and while she is writing something down, the child quickly grabs that item. Escape-motivated behaviors. Just as the name of it describes, these behaviors are used to escape a situation. Escaping a task or situation allows an individual to terminate or postpone an aversive event. Many people talk about a person having cold feet before their wedding, and some do actually escape. Clients engage in several forms of behaviors to escape a task or activity or even a person. They may physically run away, crawl under a desk, flop to the floor, and roll around. If you work with children, they are creative in their behaviors and will do whatever it takes to escape that task. Some other extreme behaviors children have used are throwing up, gagging, peeing their pants, engaging in self-injury, causing harm. My little kiddo, we'll call him MB, engaged in self-injurious behaviors. When I first went to visit them in their home, I noticed holes in the wall. I didn't say anything. I thought they were about to renovate their place or something. His mom began telling me about how he had these behaviors and when he got really mad, he would bang his head on hard surfaces, and the wall was one of them, or the table. He had over 200 to 300 self-injurious behaviors a day. Many of them were maintained by escaping tasks, escaping the washroom, escaping medication, and so on. Iwata and colleagues in 1994 found that escape from tasks accounted for most of the behaviors. In practice, we see a lot of this. Learners bolting from their desk or circle time or other learning situations. Here's an example. You give your learner a puzzle. The learner bolts from the table and the task is removed, therefore reinforcing the problem behavior. The next one is automatic positive reinforcement. These are behaviors that do not require others to provide any type of reinforcement. Reinforcement comes strictly from the individual. These are behaviors that are often referred to as self-stimulatory behaviors or stereotypies. These are repetitive behaviors with a reinforcing value that is strengthened by the sensation it produces. The behavior is enjoyable to the individual and has no social purpose. We all engage in self-stimulatory behaviors. For example, how many of you like to sing in the shower? Come on now, be honest. Well, I do. Hearing our own voice can be very reinforcing. This is not the only self-stimulatory behavior we engage in. Some may twirl their hair, bite their nails, watch TV, eat chocolate, listen to music, and so on. Although we engage in these behaviors, they are most likely at a low rate and occur in private. We control where we do these behaviors. The challenge with behaviors that are maintained by automatic positive reinforcement is that it can interfere with learning. A child may flap their hands or rock and almost get pulled away from the environment that they're in, so they stop attending to their teacher. It's almost like students that daydream. It's a problem when learning is disrupted or a child isn't learning because they're engaging in self-stimulatory behaviors. They will need to learn to do this outside of the learning situations. Also, the learner is stigmatized. Most often, parents want these behaviors to stop because they feel that their child will be made fun of or stand out. Children with autism may engage in behaviors that produce visual stimulation, such as watching spinning ceiling fans or repetitive blinking, moving fingers in front of their eyes, flapping, hand flapping, gazing at nothing in particular, peering out of the corner of their eyes, lining up objects, turning on and off light switches. There are auditory stimulation. These are non-functional vocalizations such as humming or high-pitched screeching, tapping ears or objects, covering and uncovering ears, snapping fingers, making vocal sounds, repeating vocal sequences, repeating portions of videos, books, or songs at inappropriate times. In practice, we see this a lot, with children repeating parts of movies and shows, often appearing as though they are in a loop, saying the phrases over and over again. We can almost compare with someone who is singing a phrase of a song and trying to get it just right. Many of these learners I've worked with over the years have shown these types of stereotypies. These can get in the way of teaching and learning if not addressed. Self-stimulatory behaviors can often be, can have different functions. So the behaviors that I've just described can be attention seeking, they can be escape motivated, but sometimes they happen out of excitement. So you may see that your child gets very excited, or the learner that you work with gets very excited, so they begin to hand flap, or you may have a really loud screeching sound that they engage in. And those can occur at those times as well. So right now we're just looking at what the different types of functions are, but sometimes the behavior, again, the topography of the behavior looks like it's self-stimulatory of some sort, but it could be a different function. We'll get into that a little later. Let's continue. Tactile. So this is when the individual may engage in scratching or rubbing the skin with one's hands or with other objects, opening and closing fists, tapping surfaces with fingers, and so on. Vestibular. Rocking front to back, rocking side to side, spinning, jumping, swaying, pacing. Taste. Placing body parts or objects in the mouth, licking objects. Smell. Sniffing or smelling people or objects. An example of automatic positive reinforcement is the child is alone. They engage in turning the lights on and off, which results in visual stimulation. No one was with them or giving them attention or giving attention, so we can say that this is maintained by automatic reinforcement. Sometimes a behavior looks like automatic reinforcement, but isn't. That's why an assessment needs to be conducted to figure out what's maintaining the behavior, as I described earlier. Behaviors maintained by automatic negative reinforcement are used in an attempt to terminate aversive or painful stimulation. For example, someone who has an itch may apply lotion to relieve the itch, or someone who has a severe headache may bang their head to relieve the pain. Both examples are someone attempting to relieve pain or discomfort. It's important to recognize that self-stimulatory behaviors, such as a hand flap, banging their ear, or scratching, may not always function as automatic reinforcement. These behaviors may take those topographies, but have a function of escape or attention. Therefore, proper analysis of a behavior will help identify the function of that behavior and allow the practitioner to implement an effective treatment plan. Here's a chart that outlines the function of behavior divided into positive and negative reinforcement so that it is clearly displayed. This will help you when you go to study for the RBT exam. All right, so let's do another Scrabble word before we get into the quiz. The word is pi, spelt P-I, and this is the 16th letter of the Greek alphabet. The word is pi. The individual engages in the behavior to make people laugh. Which function does this describe? A. Gain access to a reinforcer. B. Gain attention. C. Escape. Or D. Automatic positive reinforcement. Or E. Automatic negative reinforcement. And the correct response is B. Gain attention. Mike pretends he is reading his book so the teacher does not call on him in class. Which function does this describe? A. Gain access to a reinforcer. B. Gain attention. C. Escape. D. Automatic positive reinforcement. E. Automatic negative reinforcement. And the correct response is C. Escape. Well done. Linda punches her sister and takes the iPad. Which function does this describe? A. Gain access to a reinforcer. B. Gain attention. C. Escape. D. Automatic positive reinforcement. Or E. Automatic negative reinforcement. And the correct response is A, gain access to a reinforcer. Terry sits beside the window and watches cars pass by. Which function does this describe? A, gain access to a reinforcer. B, gain attention. C, escape. D, automatic positive reinforcement. Or E, automatic negative reinforcement. And the correct response is D, automatic positive reinforcement. Johnny was given a puzzle. He pushes the puzzle away and the teacher puts it back on the shelf. What may be the function of this behavior? A, gain access to a reinforcer. B, gain attention. C, escape. D, automatic positive reinforcement. E, automatic negative reinforcement. And the correct response is C, escape. The RBT places a 24-piece puzzle in front of Nellie. She begins repeating sounds and vigorously flapping her hands. What may be the function of her behavior? A, gain access to a reinforcer. B, gain attention. C, escape. D, automatic positive reinforcement. E, automatic negative reinforcement. And the correct response is C, escape. Now, many people often ask me the question, well, if they're engaging in hand flapping, maybe it's out of excitement, or maybe they're just doing it because it's automatic reinforcement. I think it's really important, especially for the test purposes and just for your own ability to analyze a situation, is really looking at the antecedent and consequence of these situations. So the fact that we're giving Nellie the 24-piece puzzle and she's engaging in this behavior. Now, obviously, there's not a lot of information here, so maybe the therapist removed the puzzle, and that could be a reason why. So Nellie's learned that every time they place the puzzle, I hand flap, they remove the puzzle. So she's learned to engage in that behavior. So it's really important for you guys to look at the situation and really read the questions carefully, because I get this question a lot, because a lot of people will say to me, well, I have a niece or a granddaughter or somebody who engages in hand flapping when they're really excited. And absolutely that could happen. But in this situation, it's because we're presenting the child with the puzzle and there's the possibility of her engaging in this behavior because she's trying to escape. So again, it's all about the situation so that it can help you for the RBT exam. Nellie is playing with her toys in the living room. Her mom is in the kitchen on the other side of the house. Her mom looks over the kitchen counter and observes Nellie playing, then rocking back and forth. What may be the function of her behavior? A, gain access to a reinforcer. B, gain attention. C, escape. D, automatic positive reinforcement. Or E, automatic negative reinforcement. And the correct response is D, automatic positive reinforcement. Again, we're looking at that rocking behavior of her rocking back and forth, and we're looking at that she's alone, she's not with anybody, her mom did not attend to her because it doesn't say that in the question, so that we're going to assume in this situation that it is automatic positive reinforcement. Good job. Understanding the function of behavior will allow us to design an intervention that is more likely to be effective, since we are addressing the function and not the form. A child that is banging the table is asked to keep their hands down may only be addressing the form, banging with their hands versus hands not moving. This will not be effective. However, a child that is banging the table and an assessment determined that it was maintained by escape can have more promising results when an intervention is put into place addressing escape behavior. A functional behavior assessment, also referred to as an FBA, hypothesizes about relationships between behavior and environmental events. The purpose of an FBA is to obtain information about possible functions. There are three methods of assessing behaviors. The first is an indirect assessment. The second is a direct assessment, also known as descriptive analysis. And finally, a functional analysis, also known as experimental analysis. Indirect assessments are structured interviews, questionnaires, or rating scales. Usually family members, teachers, or others that work with the learner are asked these questions. The purpose of this indirect assessment is to identify environmental factors that might be associated with the problem behavior. These can be used to gather hypotheses about the possible events that are maintaining the problem behavior. Examples of this is the motivation assessment scale and the functional assessment screening tool. Here is an example of each. These can be found online. Indirect assessments are great because they are simple to implement, quick, and efficient. However, their weakness is they provide subjective information which may not be reliable. It requires the person to recall information. People will often guess, which is not as accurate. These assessments used allow a parent or teacher to answer yes or no or provide a 1, 2, 3 answer from a scale. Getting information from staff, parents, or teachers can be done by asking questions, and these can be helpful when the questions allow for answers that are more descriptive. This is something I do a lot in practice as an initial assessment so that I can understand what environmental triggers there may be so I can conduct further assessments. You would ask questions about antecedents and consequences like, describe the worst behavior you've ever seen. And the parent or teacher might tell you that the child, what they did. They kicked, they screamed, they threw toys. You may ask what happened just before the behavior. What were the activities being used or the location? They may say, well, we were in the kitchen and Tommy was opening the fridge. I was cooking dinner, but told him to leave the kitchen. When I removed him from the kitchen, he started kicking and screaming. Then you may ask, what did you do after that? Did the behavior stop? They may say, yes, after school he's quite hungry, so I gave him a small snack. So by asking the right questions and getting enough information, we may predict that this behavior is maintained by gaining access to a reinforcer, especially when the child is hungry. We would call this a setting event, that when he's hungry, the behavior may increase the likelihood of an antecedent event triggering a behavior. I attended a talk by Dr. Gregory Hanley, who uses this open-ended interview approach. His assessment is nice because he lays out questions to ask. The questions are detailed so that as someone who is describing the times it occurs or under what circumstances, as I explained. Therefore, we can hypothesize potential functions that can be tested. Some examples of the questions on his assessment are, how do you and others react or respond to the problem behavior? What do you do and others do to calm him down? What do you do or others do to distract him? Now, direct observations are great, but they are time-consuming. Since the practitioner can see the behavior and the events that the behavior occurs in, these assessments are objective, direct observations in which the practitioner directly observes the behavior where and when it occurs. You can use an ABC form to identify direct behaviors and note when it happened, what was the antecedent, and what was the consequence to form a hypothesis. Again, simply observing the behavior may not give you a clear function. It will give you a hypothesis as to what may be maintaining this behavior. This will help you gather and organize what antecedents or consequences are serving as a possible function. The practitioner will observe a behavior in a wide variety of places where the behavior may occur. Repeat this multiple times to get a representative sample. This may happen for about 4 to 6 hours. Now you can probably start thinking, wow, 4 to 6 hours, that's a long time. Typically, what may happen is RBTs or staff are asked to collect ABC data. There are two types of ABCs. Narrative recording, which are open-ended, allowing the observer to record antecedent behaviors and consequences. The observer would write down everything that happened from beginning to end in observable and measurable terms. ABC continuous recording, which are coded data sheets that allow the observer to check off the antecedent behavior and consequence, so slightly easier. This is an ABC sheet, which would be blank, and a therapist would write down in observable and measurable terms what happened before the behavior, and what happened after the behavior. This is a data sheet that has possible antecedents, behaviors, and consequences. All the observer needs to do is check things off. The challenge with ABC data collection is staff most often don't collect the data immediately. If you don't, you might forget what exactly happened, which in the end will not be very helpful to you and your supervisor. You need to be able to write it down as soon as it happens. The other issue is staff may quickly write down the behavior, which results in an unclear description. For example, the therapist or teacher may write down, at the table for the antecedent, behavior was crying and the consequence was follow through. Well, what happened at the table? What was the demand? Who was there? Did you remove the child from a preferred activity to start the task, and so on? Another issue is staff may describe the events using vague language. For example, he was doing his math worksheet and got frustrated. So proper training is essential if we want to use the ABC data. When the behavior happens, so many things seem to happen at once, which often makes it even more challenging to collect all the environmental events, especially the ones that occur before the behavior. Again, this may not help if a therapist writes down that they were doing the puzzle and the behavior occurred. Is it possible that removal of the reinforcer to do that task triggered the behavior? So keep that in mind. When you're taking ABC data, think about what events lead to the behavior. Think about what you did after the behavior occurred. The final assessment is the functional analysis, also known as an FA, which has shaped the clinical process in identifying functions of problem behavior and minimizing the trial and error approach. The functional analysis is used to assess a variety of problem behaviors such as property destruction, pica, noncompliance with a variety of populations as well. So it's not specific to autism. And of course, many of these practices are not specific to autism, but can be used to assess a wide range of behaviors of many. So like an experiment, there is more control with a functional analysis. The behavior analyst would control environmental factors and expose the child to them. Conditions such as play, attention, escape, and alone. It gives a behavior analyst clearer functional relationships in the FA. Isolates environmental events, exposes behaviors, environment-behavior relationships are observed. So what a functional analysis allows you to do is place a client under conditions to see if the behavior will occur, and then that behavior will get reinforced by the maintaining function. In essence, we're triggering the behavior and reinforcing it. To many, this appears to be unethical since we're provoking the behaviors, then reinforcing it. But the idea is that we are allowing the child or individual to engage in the behavior for a very little amount of time and reinforcing it so that we can properly identify the function and relationship between the environment, events, and the behavior. Exposing the individual to the behavior for a short amount of time and properly dealing with the behavior by putting a good treatment plan in place would be more beneficial than allowing the client to engage in the behavior for long periods of time and observing it and trying to figure out the relationship. The practitioner would turn the behavior on and off, allowing them to identify the function and finding a replacement skill. Once the FA is conducted, we would graph the results. We can see from this graph that the child is engaging in the problem behavior to get the adult's attention. Now, conducting a functional analysis may give you inconclusive results, meaning that determining a function was not clear-cut. Dr. Gregory Hanley discusses a new method of conducting FAs in that he starts with the interview process, and then rather than isolating the conditions, he combines them so that we would find that the client is escaping a task to access a reinforcer, which, if you think about it, many times that a learner engages in escape from a task, it may be because they want to access a preferred item. So by combining them, we can address both functions. The client would be exposed to 10 minutes of the condition and receive breaks in between. This would be repeated about 3 times so data can be collected and a relationship can be determined. Limitations. It increases undesirable behavior for a short amount of time. Since it is contrived, it may not detect problem behaviors that typically arise in natural settings. If clear results are not found, conducting a direct assessment and possible antecedents or consequences found can then be tested in the functional analysis. Complexity of the assessment and need of skill to conduct this assessment. Time-consuming. There may be minimal control in a natural setting, which makes it difficult to conduct. Risk for the client. If the client engages in severe self-injurious behaviors, provoking those may cause harm to the client. That being said, what is your role in the functional behavior assessment? As an RBT, you don't need to decide in the process in which you will be using to assess the behavior, but rather notifying your supervisor of the behaviors that are occurring in the environment. For example, if you're working with your learner at the table and they engage in aggressive behaviors such as hitting you, you should immediately notify your supervisor that this is occurring. You may be a teacher in a school and the BCBA visits once a month. You may be a therapist in a home-based program and the supervisor may come weekly. Not every program will have an on-site supervisor 24/7, so be sure to speak to your supervisor to begin that process. Now, your supervisor may begin with asking you specific questions. So knowing your learner and when these behaviors occur and what the behavior looks like will be very helpful. Next, your supervisor will ask you to document the behaviors by collecting ABCs, frequency, and duration data possibly. For example, if you're writing narrative ABCs, you will indicate the learner's name, the date, when the behavior started. You may also indicate the time of day on some of the sheets. I think this is valuable information because we may find that a learner engages in problem behaviors in the afternoon more. You will then record the antecedent in observable and measurable terms, the behavior describing what it looks like and the frequency. For example, if the child hit their head, you can indicate the number of times to self. Was it 1 single hit or 5 hits to the head? And finally, you would write the consequence in observable and measurable terms. Think safety first. Keep your client, yourself, and others safe. If the behavior occurs, don't attempt to hold them or stop them inappropriately. There are specific ways of dealing with behaviors that use specific techniques. But you want to avoid holding a client by their arms since any of this could cause more damage. Many years ago, when I first started with my little guy in the daycare teacher said she had dealt with many problem behaviors and seemed very confident in her abilities. I was quite new to handling behaviors, especially problem behaviors. We were outside and the children were playing in the playground and he was engaging in problem behavior. She ignored it nicely, but was holding him by the wrist while he was tugging away and trying to escape, but he couldn't because she was holding him tight. Long story short, Mom called the daycare the next day and reported that her son had bruises all around his wrists. Although she may have been ignoring the problem behavior, and I'm not sure if the function was attention seeking, or maybe she was just trying not to let him access a reinforcer, not sure, holding him that way caused more harm. If a child is engaging in dangerous behaviors, you should immediately protect them from injury. If they're banging their head, block the hits to their head with your arm or with your hands, getting in between the client's arm and head. If they flop to the floor, protect their head but also think about the other kids in the room. If the client is throwing furniture, such as chairs or other objects, be sure to move the other clients in the area. And of course, think about your own safety. Don't stand in front of the learner. We'll talk about crisis prevention methods in a later class, but always remember to protect yourself, block the hits or kicks. Remember, remove unsafe items from tables such as scissors, which could be used as weapons, and call for help. Don't deal with the behavior on your own. If you work at a center or school, there may be safety and emergency protocols that you can follow. But if you're in a home-based program, for example, and you're alone, you may need to figure something out with the family. Speak to the supervisor and ensure that there is a safety plan that can be used. Parents can help if they know what to do. If you work in a place with many floors, you may need to have a plan in place if you're alone. When I was working for one center many years ago, they had 4 floors in the building. The basement of the building was a gym area, so we could take the kids down there and let them jump on the trampoline, ride bikes, and so on. I was working with a 13 or 14-year-old boy who engaged in a lot of problem behaviors. Let's call him Matt. He was really tall, and now I'm about 5 feet, and he just towered over me. But we had a really good relationship, and he listened very nicely. He was really good at the table with me, but this was my first time taking him to the gym alone. So he starts jumping on the trampoline, and he's having a great time. Well, our break time was over, and I gave him a warning that it was time to nearly go back upstairs. Then I finally said, "Okay, Matt, it's time to go upstairs." He began sitting on the trampoline, and then he just laid down, and I was thinking, what is he doing? Then it hit me. He was not coming upstairs with me, but decided that lying down on the trampoline would be impossible for me to take him off that trampoline. The first thing I did was call for help. Now, I literally shouted because I was in the basement and chances were nobody would hear me. But I tried. That was the protocol. My next step was to deal with the behavior. We had a protocol in place for him. I had to repeat whatever my instruction was over and over until he complied. So I did. It's time to go upstairs. 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 20 minutes later, my voice started cracking. I was dripping sweat. I continued. 45 minutes later, he stood up and went upstairs. When I got back to the classroom, my team literally ran to me. I explained what had happened and took a quick water break and spoke to my supervisor. Moral of the story? Before you do something or go somewhere with your learner, think about your safety and the learners. I have a lot of teachers that ask me about implementing certain procedures outside during recess. My question is always, if you do this procedure, what behaviors may the child engage in? Will they bolt? That's usually the one I'm concerned about most. If yes, is the yard fenced? If it's not, implementing that procedure could be very dangerous if the client bolts. When dealing with behaviors, avoid reacting to them when they occur. Don't overreact or panic. If it's a new behavior, you've never seen it before, like the child suddenly starts screaming or throwing toys, don't reprimand it and don't say anything about it. Don't tell them it was wrong. Make a note of it, speak to your supervisor. Attending to it could inadvertently reinforce it. What if it's attention seeking and you attend to that behavior? Remember, stay calm, avoid eye contact, and block. Dealing with behavior can get your heart racing, can get you sweaty, and you might begin to escalate emotionally, feeling angry, frustrated in a sense, because you're tired and want this behavior to stop. Remain calm. Remember, by handling the behavior well, you will help the learner in the future by decreasing those behaviors. The behavior is not targeting you. It's not about you. The client is using this behavior because it has worked for them in the past. Matt laying down on the trampoline most likely got the teacher or therapist to say, "Oh man, fine, do what you want." And he's learned that when I do this, people leave me alone or give me what I want. When dealing with behaviors, I often begin humming a tune in my head to help me stay calm and focused. As I'm humming, my brain is busy analyzing the situation. So now what? The behavior data is being collected. Your supervisor conducts further testing using a direct assessment or an FA. Then it's time for you and your supervisor to come up with a plan, an intervention plan that you can implement. The plan will be evaluated to ensure behaviors are improving. So we discussed reinforcement in our earlier classes, and we'll discuss differential reinforcement in the near future. When we think about problem behaviors, we need to think not only about the problem behavior, but what desirable behaviors we want to improve. For example, if a child is engaging in problem behavior to gain someone's attention, we would look to replace the problem behavior with appropriate skills. Maybe the child can tap the person, say excuse me, or call their name. A learner engaging in problem behaviors to access reinforcers can be taught to request items, toys, and edibles. The learner may use vocal requests, signs, pictures, or an assistive device. Escape-motivated behaviors have many options for treatment, and most often we can combine interventions to make the treatment more effective. We'll discuss antecedent manipulation strategies in a later class. Learners that attempt to escape a task or demand, we can follow through, and what that means is the task will continue to be presented and will not be removed until the learner engages in the correct behavior. This is based on the principles of negative reinforcement. To remove the aversive stimulus, the learner must engage in the correct behavior. These behaviors can also be punished. Behaviors maintained by automatic positive reinforcement can help the learner by enriching their environment with toys and items. So rather than hand flapping and rocking back and forth, a learner can play with certain toys that they may like, or even teach the child to play with new toys. We can reinforce appropriate behaviors such as hands down and ensure reinforcement does not follow the self-stimulatory behaviors. These behaviors may also be punished using a combination of strategies that is most effective. For instance, if your learner is sitting at the table with no toys while you're setting up for the day, they may begin engaging in self-stimulatory behaviors. They have nothing else to do, so why not? If your learner had a toy they liked, they may have been playing appropriately. If the child engages in self-stimulatory behaviors during teaching, you may use a punisher. Both strategies together may be effective in decreasing the self-stimulatory behavior. Now, these are just examples of what could possibly happen, but you and your supervisor will definitely put a plan together to ensure the best results for your learner. What is social positive reinforcement? A, maintained by escape, B, maintained by nothing, C, maintained by attention, or D, maintained by access to a reinforcer. And the correct response is C, maintained by attention. What is social negative reinforcement? A, maintained by escape, B, maintained by nothing, C, maintained by attention, or D, maintained by access to a reinforcer. And the correct response is A, maintained by escape. What is tangible reinforcer? A, maintained by escape, B, maintained by nothing, C, maintained by attention, or D, maintained by access to a reinforcer. And the correct response is D, maintained by access to a reinforcer. Well done. What are the three types of assessments? A, direct assessment, ABC data, narrative data, B, ABC data, mass, fast, C, indirect assessment, functional analysis, D, direct assessment, indirect assessment, functional analysis. And the correct response is D, direct assessment, indirect assessment, and functional analysis. What is a direct assessment? A, interviewing parents. B, manipulating conditions. C, observing in the classroom. And the correct response is C, observing in the classroom. What is indirect assessment? A, interviewing parents. B, manipulating conditions. C, observing in the classroom. And the correct response is A, interviewing parents. What is functional analysis? A, interviewing parents. B, manipulating conditions. Or C, observing in the classroom. And the correct response is B, manipulating conditions. My final thoughts. Again, collecting data is an important part of your role as an RBT. Behaviors are never random. Be sure to document the behaviors accurately and clearly. Use observable and measurable terms. If what you are trying to say can be broken down, then break it down further. Try to incorporate details about the before and after. Each organization should have a process in place to make the data collection system easier and feasible. If not, you may need to speak to your supervisor about your concerns. Maybe you feel that ABC data is not being collected due to time or lack of data sheets, whatever it may be. As an RBT, think about relationships and share those with your supervisor when they conduct interview-type assessments. Again, I can't stress enough how important it is to speak to your supervisor. When a behavior occurs, don't leave it unaddressed. As the frontline staff, you spend the most amount of time with your learners. And by sharing this information, we can do better for our learners. I want to thank you for joining me today during our class, and I'll see you at the next one. All right, welcome everybody to our competency component. This time what you're going to be seeing are a few videos where one of my learners is acting along with me. He is a great learner who's participating in this, and we got him to get some acting skills going. So this is very exciting for us. These are, they've been rehearsed, but what I need you guys to do is write the ABCs of what is happening. Which one is Shimmer? The one with the pink hair?
Yes.
Oh, she's so pretty. And what about Shine? Is that Shine?
Yes, because she has blue hair.
Because she has blue hair. Well, that's really cool. Who's this person?
Leah, because she has yellow hair.
Oh, okay. All right, here. I'm going to take the book now. Do the puzzle.
No, I don't want to do the puzzle.
All right, so let's do this one together. The next few, I'm going to let you do them on your own, but I want to walk through one together so that you feel comfortable and confident in what you wrote down. So remember, you want to write these in observable and measurable terms. You want to be as descriptive as possible. So in this example here, you see that we're sitting at the table together. He's sitting across from me. The antecedent is me taking the book away and presenting the puzzle. And that triggers the problem behavior, which is him saying no. He pushes the puzzle away, he grunts. I think he folds his arms in the video, and he's got the squinting face going on. So all that description in there is really important. Now, the consequence, you can see here that I don't follow through with the activity. I really just kind of let it go, and I let him get away from doing the puzzle. And now in this, you don't really see me giving him the book back, so you don't really know the final result of it. Again, the consequence here, because it's missing, you may have had a hard time actually writing it down because you don't know exactly what happened. What we do know from what we saw is the person did not make them do the puzzle, did not follow through. We don't know if the puzzle was removed. So those are things that, again, when you're actually writing the consequence, you're going to need that information, or if you were in that situation, you're going to need to write that down. Again, most often we're writing ABCs because we've experienced it, we've gone through it with the learner, so you're going to write down what you did. So I removed the puzzle and gave the book back and ignored the problem behavior. That could potentially be the consequence of that. Do your work. You got to do your work, buddy. Remember, you need to do your work. All right, buddy. My turn to take the book.
No, it's mine.
All right, take it, fine. All right. All right, buddy. I'll be right back, okay? Stay here.
And that's Zach, who makes a cupcake mess.
Okay, so Leah and Zach want to make cupcakes.
But all they make is a mess.
They're going to make a mess? Oh, boy.
That's silly.
That is very silly. After Zach leaves, Leah calls her genie friends, Shimmer and...
Shine.
That's right. What color is Shine again?
Shine's hair is blue.
Her hair is blue. That's right. And who's that?
Nahal.
Okay, is that the cat?
Yes.
Okay. And what is this over here? Really big.
Cake.
It's cake. Do you think it's sweet or sour?
Sweet.
It's sweet. Do you like cake?
Yes.
I like cake
Because
too.
Tala likes it.
Oh, yeah? Okay, here we go. Let's do some work.
No, I don't want to do work.
Well, okay, that's fine. I'm just going to put it away. All right, so do you want to do the books then?
Yes. And this book, please.
Which one?
This book.
What's it called?
Skate Together.
Skate Together. Do you go skating?
Yes. And I'm going to continue reading this book.
No, I'm not going to let you read the book. I'm going to put it away.
No, it's mine.
Okay, maybe I'll give it to you then to read. Okay, all right, here you go.